Open. Do we have
Recording in progress.
Do we have any actions? I'm sorry. Can we have General Counsel read us out of closed session?
Thank you, Chair. So the council met in closed session regarding item 5.1, hearing under Health and Safety Code 32155. No reportable action was taken. The board also met in closed session for items 5.2 through 5.5 regarding conference with legal counsel regarding existing litigation. Again, no reportable action was taken. The board met for item 5.6, approval of closed session minutes. Again, no reportable action was taken. And lastly, the board met for item 5.7 regarding a hearing for medical staff credentialing. And the board voted unanimously to approve the recommended medical staff credentialing. And that concludes my report.
Thank you so much for that. Are there any deletions or corrections to the posted agenda? Seeing none, then we'll move on to item number 10, and that's input from our audience. And this is an opportunity for the public to make comments on anything that is not on the agenda. If I have anybody who would like to speak, if they would raise their hand, then I can go through the rules.
Chair Wong, it does look like we have the public wanting to speak. So if you want to go ahead and give your spiel about the 3 minutes,
okay.
That'd be great.
Thank you. Thank you so much. So again, the audience input is an opportunity for members of the public to address the board on items not on the agenda. If you wish to make a comment, you can either raise your hand or use the icon on the Zoom lens or the Zoom screen, and you will be recognized. Once you're recognized, if you could give your name for our record and then proceed with your presentation. You have 3 minutes to speak to the board. And if it goes beyond that, I do apologize ahead of time that I will have to cut you off. Also, there's the opportunity for anybody at home to write into having their comments given to the board, but that has to be 24 hours before the meeting, so the board has the opportunity to read them prior to the meeting. So on that note, if our clerk could help me by letting me know who would like to first speak.
Sure. It looks like we have Meg Helm.
Okay, Meg.
Hi there. Good evening. My name is Meg Heim. I provided a public comment along with 4 others during last month's board meeting, and we were urging Tahoe Forest to begin to engage on the topic of climate change. Though I know the board isn't permitted to respond to this comment right now, I wanted to follow up on the last meeting and see how you've considered our comments over the course of the past month. We'd be curious to hear what you discussed, how the board is planning to address this issue going forward, and in what areas you'd be open to additional feedback and support. I'd also like to know how we and really the general public will be able to follow along with your discussions and decisions made on this topic. And we look forward to hearing more from you on this. Thank you.
Well, thank you, Meg, for your comments. I do want to tell you that we can't engage again in a discussion because it hasn't been agendized. But I will share with you that Tahoe Forest Health System has been in and has continued to take action on climate change sensitive and health related activities. There were several comments that were made last month that were misleading and at times not factual. So we've asked the board has asked our staff to put together an update of the activities, the process, the planning that all relate to climate stewardship and public health. I do hope that you will be following us. We'll have this report early next year. And again, once we give it, then you can have more input on it. And you will hear that we indeed are very sensitive to what's happening with climate change, and that within our ability, are taking action on decreasing our carbon footprint. So thank you again for bringing that up.
Thank you.
Any further comments from our audience?
It looks like we have Jana Bloomquist.
Okay, Jana.
Hi, thank you. As she said, my name is Jana Bloomquist. I'm joining Meg in asking. I appreciate, Alice, your remarks that the board and the hospital is taking action. I'm interested to know the details of what was misleading that was stated by the public, by myself and Meg and others who attended the last board meeting. So I'd be curious to understand a little more about that. And also, I wanted to mention that last week's Health and Climate Forum at Town Hall that the hospital was not part of, and I still don't quite understand why, was fascinating, and some of the information was alarming. Community members who attended the meeting asked some great questions too, including regarding the mental health effects of climate change and the effects of wildfire smoke on children's health and development. And as a local mom, I want to know the answers to this as well. I hope Tulloch Forest takes the opportunity to become a trusted voice and resource in our community. The people of Truckee and Tahoe need the hospital's support and guidance in dealing with this powerful threat to our health and our well-being. Thank you.
Thank you again, Jana, for your comments. And again, I ask that you follow us because you will be getting reports on what's happening. Again, we're working in partnerships. We don't have the answers to everything. We're doing what we are able to do in terms of climate stewardship. So thank you again for your comments on the meeting. Martina, anybody else?
I don't see anyone with their hand raised.
Okay. If there's no further input from our audience, then I'd like to go to input from our Employees Association. Do we have anybody from our Employees Association that are wanting to speak to the board? Okay, seeing nobody here from the Employees Association, then we will move on to item number 12, which is our consent calendar. And these are generally reports that are non-controversial. They come from our leadership team with the activities that have been going on over the past month. We have some policies that have been approved and that have been reviewed by several committees. And then again, our resolution to continue with teleconferencing. So is there any board member that would like to pull any of the items under consent calendar?
I wanted to pull the COO's report. I'm interested in the problems we're having and moving forward with the city of Truckee approving or reviewing our requests on our projects.
Okay, let me just find out, is our COO?
I don't know if Louis may have had to go to his daughter's event.
He is planning to attend or jump back on for questions if his report was pulled. So I will let him know right now that you have questions when you get to that item.
And then that will be discussed under item 15. Anything from our staff that they'd like to pull? Any comments from our audience?
Alice, just a quick thank you to Crystal and her team for the additional input on the financials, or the additional detail on the financials. It was really helpful.
Thank you. Okay, if there's no further comments, can I have a motion to approve the consent calendar without the COO board report?
I so move, Director Barnett.
Okay, it's been moved by Director Barnett, so we need a second.
I'll second, Michael.
Okay, so it's been seconded by Director McGarry that we approve the consent calendar minus the COO board report. Can I have a roll call vote?
Director Barnett?
Yes.
Director McGeary,
Yes.
Director Brown,
Mary, you're on mute.
Thank you. So sorry. Yes, I approve.
and Director Wong.
Yes. So the consent calendar has been approved minus the COO report. Okay, we have item 13 for board action, and we have a resolution honoring Nan Healy, who's in our audience. Welcome, Nan. It is great to have you. And I think we have a little clip about our Nan. Martina, can you turn that on?
Congratulations to Nan Healy, the winner of the 2022 Nevada Hospital Association's Making a Difference Award of Excellence in Volunteerism. Nan appears to be deeply loved by the staff at IVCH. What does it mean to the hospital to have a volunteer like Nan?
I can't say enough about Nan and her involvement in the health system. She brings just a cheery attitude. She's just somebody that everyone recognizes in the hospital. What was so impressive is that she's actually volunteered for more than 17,000 hours. You know, the last couple of years, volunteerism hasn't been as easy in terms of access to coming into a gift shop and so forth in a hospital. So there's no doubt in my mind that she would have done 20,000 hours by now. Real just cheerfulness at a time where things can be difficult in healthcare. And so she improves morale. She's just a wonderful person to have with us. And we are so fortunate to have Nan.
Nan Healy is a pillar of this hospital. Everybody knows her that works here. And over the years, she has contributed so much. The auxiliary that she actually leads has given a lot of funds for us to get equipment for the hospital. And she just is a pleasure to have around. I call her the Energizer Bunny. She just goes and goes. She's always able to figure out ways to continue her quest to raise money for the hospital as well as for the community, and scholarships for people to graduate from high school in the area and go on to the medical field. She's just the leader in terms of wanting to start something and get other people excited about volunteerism. And, you know, she really just brings a lot of compassion, she's just got a charge and a purpose. You know, that's just fantastic for a small hospital to have somebody that can just really bring a sense of pride with regards to the hospital and want to get involved and want to help us grow and want to help us improve care every single day in the way that she can.
How has Nan's giving spirit been an asset to IVCH?
How do I explain it? Her just giving attitude, it's all about us, and rarely is it about Nan. It's all about us. And I admire her in so many ways. I envy her energy and her determination to get things done. And that is just why we all love her so much. And I truly cannot say enough about her and her efforts over the years. It's been phenomenal.
We're just so lucky to have Nan on our team.
Well, Nan, congratulations. And we're going to give you a standing ovation for that. We're so proud that you have given so much to our organization and all the things that you've done. We do have a little something for you as well. We have a proclamation, and I'd like to read that to you, and then maybe you can say a couple words, okay? So this is our resolution. Whereas Tahoe Forest Hospital District is a hospital district duly organized and existing under the local healthcare district law of the state of California. And whereas the board of directors wishes to recognize Nan Healy for 28 years of dedication, passion, and loyal service to Incline Village Community Hospital. And whereas Nan Healy is the longest standing volunteer of the North Lake Tahoe Healthcare Auxiliary, committed over 10,000 volunteer hours. And whereas Nan Healy organized 2 fundraiser events a year for the auxiliary, and whereas Nan has been a valued board member of Incline Village Community Hospital Foundation for almost 10 years, and whereas Nan is the definition of selfless volunteer, exhibiting exceptional volunteerism and generosity. And now, therefore, be it resolved that the Board of Directors of the Tahoe Forest Hospital District hereby thank Nan Healy on behalf of a grateful community for her commitment and service to Incline Village Community Hospital, the employees, and above all, the patients that we serve. So thank you again, and I'll get a vote from our board to pass this resolution, and then I'll have you say something, Nan. So can I have a motion to pass our resolution for Nan?
This is Director Barnett. I move that we pass our resolution of appreciation for Nan.
A second, please.
I would love to second that. This is Mary.
Okay, that it's been moved and seconded that we approve the resolution to thank Nan Healy for her volunteer efforts to Incline Village Community Hospital and North Lake Tahoe communities. A roll call vote.
Director Burnett?
Very yes.
Director McGeary?
Yes.
Director Brown?
Absolutely.
And Director Wong?
Absolutely. So the resolution has been passed. And again, Nan, we are so grateful to have you as part of our health system. Would you like to say a couple words?
Oh, I thank you very much for this. I'm so honored. But I love to volunteer. And I guess it started way back in probably 1965 when my children started getting into things. And so anyway, Incline has been my home now for over 30 years. And I've been involved with the hospital mainly most of that time. So I thank you wholeheartedly for this resolution. Thank you.
Thank you. Wow.
Thank you. And the one thing I have to comment in the resolution, it says, you're the longest standing volunteer. So I can say to you, you can sit down now, Nan.
I sit a lot these days since I'm on oxygen 24/7,
Yeah.
but I also get around a lot. So
Yes, you do.
thank
And
you.
again, thank you again. Now we can move on to item 14, and this is the 2022 Cancer Quality Report. We have Dr. Kame as well as Kelly Botley to give reports or to go over the report. So Dr. Kame, take it away.
Thank you, Chairman. Thank you, directors. I'd like to share my screen if I may. And we'll get started here. So it looks like a lot of slides, but I'm not going to read things to you. I don't believe in that. So we're going to talk about what we've been doing here this last year in the Cancer Center. This is just the number of new patients. It continues to grow over the years. It looks like maybe we flattened off. This is all of our new providers coming into the Cancer Center. These are all of our accreditations, and there are 2 that happened this year that I want to tell you about. And the next one is this looks troublesome, right? That the number of radiation treatments has fallen off dramatically. This is actually good news because the science shows that you can accomplish the same thing with less treatments, higher doses of radiation and less treatments. So you can see I've listed there the numbers have diminished for many different scenarios in which patients need radiation therapy. So this is actually a positive. If we look at another metric, this is added to your slide deck, just the number of total patient visits, and you can see we continue to increase. And so even if we see the same number of consults each year, year over year, there's a tail to that a number of consults. So it's not just a consult, you see them and you're done with them. Their care can be intensive, and so the follow-up visits can be quite enormous. We're going to talk about our clinical trials program because we first of all, I want to tell you how we participated in clinical research in the era of COVID. We were part of the ASCO COVID registry, and that study has been completed and published. We were also part of the NCI National Cancer Institute COVID-19 and cancer patient study to see how COVID affected cancer patients. That has been published in an abstract form. So we're very proud that we were able to contribute to the body of knowledge of COVID and cancer. Here is our number of clinical trial accruals. As you may know, we are part of the UC Davis Network affiliation for clinical trials. To do clinical trials, you need a robust administrative task force, and IRB, and all of these elements for clinical trials that we don't have here at Tahoe Forest. And so we use those services through our affiliation with UC Davis. These are all the other affiliate network sites, Mercy Center in Merced, Rideout Center, and then Chico Cancer Center as well. And you can see that Tahoe Forest, for as small as we are, far outdo the other cancer centers in terms of network trial accruals, number of patients on study. And I can tell you for 2022, the number has gone from 17 to 18, so it's updated to 18. These are the number of disease trials opened by disease site over the years. These are the number of enrollments by disease site. And so year to date here so far, we are at 18% so far in 2022. I've got to tell you, that number is typically only achieved by an NCI designated cancer center. So these very large cancer centers like UC Davis and UCSF, they get that percent like this, but it's quite surprising that a small cancer center like us can have this many patients enrolled on clinical trials. How did we do that? Well, we noticed we weren't happy with what was happening. And so a couple of things happened. We developed a task force to analyze the problem. We worked closely with UC Davis, and they actually hired a couple of people that made some changes for us. We identified that we wanted better clinical trials that matched our patient population. And so they did that for us, and hence we were able to enroll more patients. So, and again, so this level of performance is usually only seen at NCI designated cancer centers. I want to talk to you about our accreditations. I've mentioned these in years past, and I'm going to go over two of them that we were recently reaccredited, but we are accredited with the American College of Surgeons Commission on Cancer. We got reaccredited here this fall. We are also part of the ASCO Quality Oncology Practice Initiative that I'm going to tell you a little bit more about, and then several other accreditations that you can see there as well. So the American College of Surgeons Commission on Cancer, the COC we call it, we had our survey on 9/28. We were found to have no deficiencies. I have to tell you, only about 4% of all programs that go through these surveys come away with no deficiencies. We were one of them. And so it's not easy to do that, and we did that. The tangible benefits for the patient, I'm not going to read these to you. These are in your packet, but it's multifactorial, right? So if I were a patient, I would want to have all these things documented and at my disposal. The other tangible benefits, it provides, I think, most importantly, just kind of a structure by which we can measure quality. If you had a clinic, how would you know you're doing well? Well, this is one metric by which there's very specific standards that we meet and work toward. The tangible benefits go all the way from prevention, cancer prevention, to screening, to diagnosis, to treatment, to survivorship, to end-of-life care, as well as many administrative things. So it's a full continuum of cancer as well as the administrative backbone behind that. That's not just words that I gave you on the previous slide. Here are all the metrics that actually go to each of those buckets I showed on the previous slide. So we can't just talk about it. We actually have to prove it in all of these metrics. So very robust reporting we do. The COC, Commission on Cancer, uses quality data elements that are verified far and wide. And we measure not just how we do in the cancer center, but within the hospital. So cancer care, no matter where it is seen within Tahoe Forest. Here's just some of the quality measures in the COC by disease site. So 20 different metrics we need to meet in these different cancers. I'm going to focus on our most common cancer here in the cancer center, and that's breast cancer. And so here's some of those metrics that we have to meet. You can see over on the right-hand side, how do we do in Tahoe Forest? We're nearly 100% straight down the line compared to other COC programs that are not nearly at 100%. So you have a lot to be proud of here in the Cancer Center.
And the one comment I want to make about that is that you don't see this in every cancer program you look at. And this happens out the gate without going back and re-looking at the data for the most part. The doctors do a really great job not only following national guidelines, but documenting to them so that that data can be abstracted correctly the first time out to the Commission on Cancer.
And so, as Kelly says, these metrics are not something that I can give the Commission on Cancer. It's drawn from our tumor registry. So it's an independent body of data abstractors that just abstract what we perform here within the clinic or within the district in terms of cancer care. So I can't fudge these numbers. Even if I wanted to, I couldn't. So this is real data. Let me tell you about the other large initiative we do, and that's the Quality Oncology Program Initiative, or COPI. And so we've been a part of this from when it was almost initially offered many years ago. We just did a maintenance data submission, and we did that through CancerLink. I've talked to you about that before. So CancerLink is a program that looks at our electronic medical record and takes out elements that we can look at easily and compare and contrast and study. It is also a mechanism by which we submit data through CancerLink to this organization, COPI. So in June 29 of this past year, we submitted our data again electronically. I can't touch it. I can't do anything with it. It's a sweep from the EMR. We had an 84% compliance. That sounds like, well, that doesn't sound so hot. I mean, the last slide you were 90, 100%, right? COPI does kind of an algorithm sort of thing to, the word is not right. The word that comes to mind is to massage the data, but it manipulates the data somehow. And I'm not even sure I can give you the formula on how that's done, but I've got to tell you that 84% compliance is one of the highest scores in the nation. So, Kelly, do you want to talk to that?
They came up with an algorithm because most of the programs, as when we started out, do all this manual abstraction to submit this data. It takes hours and hours and hours. One of the great things about CancerLink was that we didn't have to do that anymore. So when COPI had to make the CancerLink extractions comparable to the manual data coming in. And so they went through this extensive algorithm, and I don't understand their algorithm, but it always looks less to us, but we're always up in the top of the country.
Right. So we got to be happy with it, right? So even though we're kind of one of those, 97, 98, 99% kind of providers here, but 84 is good here. Let's talk about what we do here in terms of our quality program and improvement. Certainly we follow along with the COC, the American College of Surgeons, COC, and COPI. But what is more exciting even than that, I think, here is that we set our goals internally within the Cancer Center and Tahoe Forest District annually. We look and see, what do we need to shine a light on? What do we want to study and improve? Or just see, how are we doing? Let's look at this. And so we identify multiple quality studies ongoing We even in real time, and Kelly will say she has a hard time keeping up with us because she's the one that says, well, that's a great idea. Let's make sure you guys get credit for this. And so she's always playing catch up because we're always moving out fast on new ideas on how to improve. And so a couple of the things we did here was we need a lung cancer screening program. So you may have read the news that came out just either yesterday or today that about in the U.S. here prior to COVID, about 14% of all cancers were found by screening, only 14%. It's high for breast and colon, but it's not high for lung. And that's because for a lung cancer screening, you need to have a CT scan. We have been trying for many years to get that program up and running here. It's not for lack of trying, but we finally have a software system we need to have for this. It's also going to be used by mammography. And so it's been approved for purchase, and hopefully we can implement this in 2023. So we're very much looking forward to this.
And one thing I want to give credit to for this is last year in the year of 2021, one of our quality improvements was our new director, Derek Baden, who's on the line. And Derek swept in and took on this project. And within about 2 months, it was living and breathing. And now we will see it implemented.
Yay. Can you explain a little bit? I'm sorry, this is Mary. Can you explain how this is going to work?
Yes, so there's specific criteria on who should be getting a CT scan to screen for lung cancer. It depends on your age and how many years of a smoker you have been. And then if you meet those criteria, then it's recommended you have a low-dose CT scan of your chest. That's a CT scan without contrast, so you don't have to worry about damage to the kidneys from the IV contrast or allergies to the IV contrast. And that's repeated, I think, every year. I would have to double check on that, but it's repeated every year. And so you're looking for lung nodules before they become symptomatic.
Wow.
And it improves survival. It's been shown to improve survival, so very much worth it.
Great, thank you.
Yeah.
There are programs across the country who have this up and running. And usually when you see the percentage of lung cancer, it's usually a very high percentage at stage 3 and 4, where you have very limited abilities to do anything about it. And a lot of those programs have what they call stage shifted. They've shifted their higher percentages to stage 1 and 2. So those patients will survive.
Great. Wow. Wonderful.
So I'm just going to mention some of the other clinical studies we looked at. Those 3 are listed there. We're going to talk about prostate cancer. We're going to talk about smoking. And then finally, our financial barriers to care program. So in terms of the clinical studies, this is kind of a deep dive. We pick a disease each year and do a deep dive and look at how do we compare to standard guidelines on this. And so this looked at hypofractionation radiation therapy for localized prostate cancer. And this was performed by our radiation oncologist, Katie Lagarza. And so not to get too detailed, but as we talked about earlier, the number of doses of radiation we're giving now is less. And this is one example where we found that you give a higher dose with each fraction of radiation and you get a better result. And so this study looked back to see, did we follow that shift in guidelines? And so men with prostate cancer are separated into individual buckets, and these are some of those individual buckets, but don't get lost in the details. The bottom line is here, we found 28 charts reviewed for patients receiving definitive radiation therapy for their prostate cancer in 20 and 21, and we put them into their appropriate buckets, and we found 12 patients for whom they should get that hypofractionated, higher dose, less doses of radiation. And we looked at those 12 patients, and all 12 patients received the newer higher dose radiation with less fractions. And so we're meeting the evidence-based guidelines here at Tahoe Forest for men with prostate cancer. We also looked at smoking. And so we do a pretty good job about asking patients about smoking. We want to do better. We want to ask about their smoking status, and if they're smokers, offer them ways to overcome that. And so We demonstrated a 92% compliance in documenting smoking status of each patient, and we've devised many ways in which we hope to improve that in the future, and we'll go back and study that again. And then the last thing I wanted to talk to you about is the barriers to care. There's many barriers to care, right? And one of them is the finances. There's much written about the financial toxicity of cancer care. It's not just cancer care, it's medical care, but cancer care in particular. I mean, we give drugs in the infusion area that are $100,000 hanging in that bag. And so no one can afford that. So how do you help somebody with these finances? So one of the things we did is we have about 35 patients enrolled in a copay assistance for infusion drugs. Some of them are eligible to receive free drug. And we took a closer look at how are we doing in terms of our financial assistance. And so for the last year, this is what we came up with. This is the financial costs that patients avoided by what we did for them, looking for copay monies or free drug assistance. So that's a substantial amount of money. This is not just this is hard work that our team is doing. I've added to your packets just a statement about what our financial navigation program is. And so it's a well thought out program that actually engages with every single cancer patient that walks into the cancer center to give them an idea of what their treatment may entail in terms of financial cost to them and how we're going to help them with that financial cost. It's not one and done. We keep coming back to them with how are they doing? How can we help? And so I just think that's a model for healthcare everywhere, right? Not just in the cancer center, but every clinic there is. You know, when you walk in, what is this? How is this going to hurt me financially? And so I'm just very, very proud of our team that we have stood this up. Nobody told us we had to do this. It was just our intrinsic sense that we need to do this for our patients. So you can be proud, I think, of the service we're doing here.
Great.
So I'll round it back to all our program accreditations and affiliations. All of these things, our little tiny cancer center does all of these things. And the highlights of that is in the COC, only 4% of programs in the nation are surveyed with 0 deficiencies like we were this fall. In our COPE, we are one of the highest scoring programs in the nation. Our clinical trials is on par with NCI designated cancer center. And last I'll say, I think we do it and we do it well. The patients are happy. Our patient satisfaction survey results are consistently 90%. So in our radiation oncology, we have hit 100% patient satisfaction here a couple of times. So I challenge you to find that anywhere. So with that, what is the secret sauce? So I've been practicing medicine now for 45 years. And so sometimes I have to think back, well, you know, what is my take on all this? So what is the secret sauce here for Tahoe Forest Cancer Center? We're a small cancer center. That's a good thing. This allows us to give very personalized service. We discuss every single patient coming into the cancer center every single day. The whole team discusses them. Not just the docs, but everybody does. And so that means even the front desk knows, you know, this patient is coming in, they're going to be getting bad news. They're incredibly stressed out. They know that the minute they walk in the door. And so everybody knows what's going on with every patient in a positive way. I would say from top to bottom, every employee is deeply committed to excellent patient care. Process improvement is not a directive. It's not a policy. It's not a directive or a regulation. It's just an organic, self-driven way of life in the cancer center. So I got to give a shout out to Kelly Bottomley. And she came on board in 2014. And that's when I just took over the Commission on Cancer, the COC. And of course I had the book of directives and all the details on that. And there was a group of us that met about once a week to muddle through those and try to figure out, well, what do they mean? We can read it, but what do they really want from us? And it was hard. It's not at all clear in what they give us. And somehow this little angel dropped out of the sky and landed in our lap, and her name was Kelly Bottomley. And she has a wealth of experience. And so she looked at us and she said, well, I can help you out. And she did, and she does. And so credit to her, we made it through. And what she does is she doesn't tell us what to do. She just helps us shine to tell everybody else what we're doing well. And so just a huge debt of gratitude for Kelly. So
Great. Well, I really want to call out Dr. Kame because I've worked with different cancer centers in the Bay Area, in the Reno area, and other centers across the country. And it doesn't happen all the time that you get a doctor who's invested in the process and the outcomes. And it starts from the top down. And we have this fabulous director now, Derek. And then we have Dr. Kame's guidance from the physician side. And when she told me, oh, by the way, and she'll share her news in a minute, I think my heart stopped for a moment. So it has been really one of the highlights of my career working with her. She is so dedicated to great care, and she always does it with a smile on her face. And she has just been a pleasure to work with. And I am going to miss her immensely.
thank you, Kelly. Thank you. And that takes me to my last slide. That you got to me there. So change is inevitable, right? It's going to happen. I'm going to be retiring from full-time practice here at Tahoe Forest next July. The quality care will continue. Don't have to worry about that. And I just want to thank you for the opportunity. So thank you.
Hey, any, how do I follow this? Any comments or questions about our cancer quality improvement program?
This is Director Barnett. I just want to express appreciation for the years of service that Dr. Kame has put in. She's extraordinary. She's made our cancer center extraordinary. And that's a legacy that's going to be hard to live up to. But I think she's got people in place who will use her as a example. So we just thank you from the bottom of our heart.
Thank you very much.
Yes, thank you so much.
Any comments from our audience? Well, Dr. Kame.
Thank you, Dr. Kame.
Thank you so much.
I want to thank you. And again, thank you and your staff and Kelly for all that you do to ensure that our patients, any and all of them, really receive the best care possible. And again, I think you've got a staff now that's learned from you, and we will continue it on. But I think about when we passed Measure C to develop the Cancer Center and all the controversy around it. And when we look at the outcome of it and the number of patients that we've touched, it's amazing. And they've all had positive experiences. And that's really important when you're faced with such a disastrous diagnosis. So thank you again. We wish you all the best in retirement.
Alice, I'm looking at this screen here, and I see, at least the way my screen is laid out, I have Dr. Kame, I have Kelly Bottomley, and I have Nan Healy, all forming this wonderful V, and it speaks so well to what you've created and what we're all about. It's just remarkable, and thank you all.
Yep. And again, it's part of our greater system. So again, thank you guys.
Thank you.
The other person that I kind of left out was, I wanted to acknowledge also Janet Van Gelder. Janet is a great partner in the quality part of the program. She's a standing member of Cancer Committee. And whenever I have questions or I'm trying to make a decision, she's one of the people I always go talk things out with. And so she's a valuable piece of this as well.
Thank you again for that comment. Okay, and we're going to move on to item 15, which is what Director Barnett pulled, and it's the COO report. and he may not be on the line, but we do have our CEO who can speak to your issue, Bob. So if you want to, again, let him know why you pulled the COO report.
Yeah, when we go to the COO's report, we have the Levon parking structure project and then the other Lake Street housing project. And basically what we see is that our design development work is done, but the project's been put on hold awaiting City of Truckee's evaluation of our master plan. And I know that we want to move forward. And I would just like kind of an update to see if we can somehow partner with the City of Truckee to help us through this development and project approval.
Okay, and I think Harry's already met with the town, so he can give us an update. Sure. Good evening, Director Barnett and board members. Wanted to just give you a little bit of an update and on what's been going on to date. Our Director of Facilities and Construction has been working in a very professional and thorough way, really since 2019, bringing forth our various construction needs to serve our patients better for the long-term future. One of the very first things was our new parking structure on Levon Road. We were advised to not piecemeal a variety of requests that were assumed to be coming. And they said, prepare a master plan and bring all of that to us, which was done responsibly. We did have a friendly non-action joint meeting of the Planning Commission and the Town Council. I believe it was in October or November of 2021, so about 13 or 14 months ago, where Dylan did a nice presentation to the town on our comprehensive master plan, which is designed to serve needs out 10 to 30 years into the future. And then we've continued to stay engaged, and we presented another thorough set of documents in March of this year, to which we had not received a typical comprehensive response. And so our Director of Construction and Facilities, or outside real estate counsel, and myself met with 3 top individuals of the town last week for about an hour and a half, and really thoroughly reviewed our concerns with this critical matter for patient care for the future. And we were pretty clear on all of the issues. We did answer questions and so forth. And our small group does need to, we've scheduled a time to debrief early next week, and we'll need to pick probably a different setting than this setting to probably discuss some next steps, so that we really do honor our patients and can really provide thorough care for them for the future. So we've been very thorough, been pushing pretty hard, but we do need to debrief and plan a little bit more, and we'll seek your input possibly in another type of setting fairly soon.
Thanks for bringing us up to date. Appreciate that.
Okay. Any other comments about the CEO report on the projects that were presented? Anything from our staff or the audience? If not, can I have a motion to accept the COO's report as presented?
This is Director Barnett. I move to approve the COO's report as presented.
Okay. A second, please.
I'll second, Michael.
Okay, so it's been moved by Director Barnett, second by Director McGarry, that we accept the COO's report as written. A roll call vote.
Director Barnett?
Yes.
Director McGarry?
Yes.
Director Brown?
Yes.
Director Wong?
Yes. So the report is accepted as written. All right, then we'll move on to item 16. And these are board officer elections. So we have our board. We've got everybody in place. Director Barnett was elected as the incumbent this past November. And now it's time to look at the offices. The offices stay in place for 1 year. And then in December, again, we relook at all the offices. So the one that we begin with is the chair. And so can I have a nomination for a chair position?
I would like to move that Alice Wong be appointed chairman.
I would second that motion.
Okay, and the one thing about the chair position, it has to be a unanimous vote because the chair can only serve a year at a time unless it's unanimous. So that being said, could we have a roll call vote?
Director Barnett?
Yes.
Director McGarry?
Yes.
Director Brown?
Yes.
Last but not least, Director Wong.
Yes. So thank you, board, for your confidence.
Thank you, Alice.
I look forward
Alice, you did a great job.
Yeah, I look forward to next year and the things that we'll be able to do. Okay, then our next position that's up for election is our vice president. And the vice president takes over the position if in the absence of the president. So do we have any nominations for our vice president?
Alice, I think you're looking for a vice chair.
Oh, I'm sorry, vice chair.
And,
thank you.
And I would love to nominate Michael McGarry for that position.
And Michael, are you willing to serve if okay. So I have a nomination for Michael McGarry for vice chair. Can I have a second?
I'll second that.
Okay. And then a roll call vote.
Director Barnett?
Yes.
Director McGarry?
Yes.
Director Brown?
Yes.
Director Wong?
Yes. So welcome, Michael, as the vice chair.
Thank you.
Our next position is secretary. And this position is one that has to be aware of the minutes and making sure that they are transcribed, as well as signing any documents that are necessary. So can I have a nomination for a secretary? I'd like to nominate Bob Barnett.
Yeah, I was just going to say,
Yeah.
you just took it away from me. Yes, absolutely.
Master of details. Yes.
Yes, yeah. Okay, so I'm going to say that Bob has been nominated by Director Wong, seconded by Director Brown. And can we have a roll call vote?
Director Barnett?
Yes.
Director McGarry?
Yes.
Director Brown?
Yes.
Director Wong?
Yes. And then our last position is the treasurer. And the treasurer is required to attend the financial committee meetings, but not necessarily chair that. And they need to watch our money is what they need to do. So can I have a nomination for our treasurer?
Can I ask a question?
Yes.
Can somebody be nominated in absentia?
Well, if you're not at the meeting, you're going to wind up getting it.
Yes.
Yeah, the answer is yes.
But
This is Director Barnett. I nominate Dale Shamblin.
yes,
I'll
I
second.
second the motion.
Okay. And I'm sure he'll accept it. He has served as our treasurer for so many years and knows how to work with Crystal. So could we have a roll call vote?
Director Barnett?
Yes.
Director McGarry?
Yes.
Director Brown?
Yes.
Director Wong?
Yes. So now we have a full set of officers. Next month, we will be looking at our committees again. And if you have an interest in serving on a particular committee, remember there are 4 of them, that if you'll submit it to Martina, she'll give me a list of it, and you can prioritize it of which one you want to be on, which is your second, et cetera, so that you can work on things that you're really interested in. Again, these are board committees. You are the driver of those committees, and that information that you want, you're going to get through the committee itself. Okay. Do we have any board committee reports?
Not this one.
No. Any closing remarks from any of our board members?
Happy holidays.
Yep.
Happy holidays to all.
Yeah. So if there's no further comments, I do want to thank our leadership committee or our leadership council, our providers, our staff, everyone who has worked so hard this year. It's been a struggle at times, and there have been great times in between. And that I hope that in our 2023, that we can continue to move forward. So happy holidays to everybody. And I want to give my line that I always give. Merry Christmas to all, and to all a good night. The meeting is adjourned.
Good night, everybody.
Good night, everyone.
Good night, everyone.
And thank you, Alex. Thanks very much for.
This was such a pleasant meeting. I hope all your meetings are like this.
You'll want to come back, won't you?
Yeah.
We strive for it. Yeah.
Have to sub with David.
Yep. All right. Give him
Bye,
our
all.
regards and wish him a happy holidays from us.
Will do. Thank you.
Good night.
Thank you for sitting in, Alex.
Thanks, Alice. Good night.
Got it.